How can Bristle help guide their habits or guide their dental team into what they're doing differently? Like, what would be some of the nitty gritty? Okay, it's not just about brushing better and flossing more. Like, what are some of these steps that Bristle can help us find?
Yeah. So some of them, if we're looking at different bacteria related to gum disease, on one hand, we can start to see, is this a patient where they're in a very advanced state of gum disease where we're going to see very rapid progression? We use a 0 to 10 scale. If they're at a 9 or a 10 on that gum inflammation score, we need to take action soon, or we probably need to take action soon because they have a very active and serious infection of the cavity. Versus, if we see early signs of gingivitis and we're a bit on the fence, we're at like a 6 or a 7 so we're into the red, but not all the way severe. Maybe we can maybe that's something we can tackle with at-home interventions. And figure out, is this a case where we can use something like Clocis or chlorine dioxide and be a bit gentler because there are some beneficial bacteria there. So we want to instead just suppress the bad, maybe incorporate a probiotic, and depending on which species are there, we can figure out which probiotic strains are most effective, because a little known fact is that certain probiotic strains are more effective against certain species. So we'll call that out. Um, Even things like, do we see a very low abundance of nitric oxide producing bacteria? So we can increase nitrate in the diet through leafy greens, beets, things like that. And these bacteria actually release um, byproducts that suppress the activity of those pathogenic species. So can help just pinpoint a bit and tailor, I think, on one hand, when do we need to be more aggressive versus less aggressive? What types of approaches are likely going to be most effective for the patient? But across different conditions, we'll have different insights.
I love that. And just for everybody listening, uh, whereas your normal dentist might tell you to brush better and floss more, Brian just laid out at least like 5 different ways that to just completely expand your thoughts of what oral health actually is. So yeah, we might need to take a blowtorch theoretically to your oral microbiome. Like might need to use some really strong antimicrobials if your saliva tests look like trash, and your gums look like trash, and you've got these systemic illnesses that have a strong correlation to these certain bacteria, then yeah, we're going to take a much heavier hand therapeutically to what we're doing. But if that's not the case, then yeah, is how the oral microbiome affecting your gut? Do we need to start there? Maybe
Mhm.
that's where we need to start. And then maybe it is just, oh, we need to brush better and floss more for these specific bacteria. Maybe add an oral probiotic. Um, and the probiotic information is so fascinating because there actually are, what are the substances called? Bactericidins that
Oh,
some of the
bacteriocins. Yeah. So yeah.
bacteriocins that some of these probiotics release
Mhm.
that are effective against these other certain detrimental bacteria. How stinking cool is that? That we can pinpoint and use a very specific strain of bacteria that's a good bacteria to kill a very specific strain of not so good bacteria.